I'm Dr. Brandy Doggett at Striegel Animal Hospital, and we know that you guys sometimes have questions regarding your pet's dental appointment and dental procedure. So my assistant Carla is going to ask me some of those most frequent questions so that we can get you the answers. Go ahead, Carla, what's the first question?
Dr. Doggett, is there anything I can do to help my cat prepare for a dental appointment?
Yes, we always offer pre-anesthetic visits so that we can make sure that your cat is as healthy as possible going into its anesthesia procedure. So this often includes an ECG that is read by a board certified cardiologist to help us make recommendations as far as tailoring the anesthesia particularly to your pet. We want to make sure that the anesthesia is as safe as possible. So another thing that we do is offer complete blood work so that we can make sure that all of the organ function is at a level that is safe for anesthesia. And if there are any abnormalities, that we can tailor our anesthesia and our treatment plan specifically for your individual cat. Other than this, the night before, we ask that you withhold food after midnight. So if you free feed, pick up that food before you go to sleep. Your cat can definitely have as much water to drink as they would like to drink until they arrive at our clinic.
Why does my cat need anesthesia for a teeth cleaning?
So just like some people who are terrified of the dentist and dental procedures, our furry friends and our furry pets, they definitely need anesthesia because there is a lot of things going on in the mouth, a lot of sounds, a lot of noise, and sometimes some discomfort. And so to make the anesthesia to make the dental procedure as safe as possible for your cat, we require them to be fully sedated under anesthesia with a breathing tube to protect their airway. We've got a lot of water in there to rinse out the mouth. We're doing oral x-rays, so intraoral x-rays. We do intraoral x-rays, so this means we take x-rays of every tooth in your cat's mouth, just like our dental hygienist does when we have our visits. We want to make sure that the part of the part of the tooth that is under the gum is as healthy as the part of the tooth that we see. And a lot of times we can see a tooth that looks absolutely normal, and we take an x-ray and there's a large part of that tooth that is not apparent on x-ray, meaning we've lost a lot of that tooth under the enamel, and it's a diseased tooth that needs to be extracted. Another thing we can see in cats is when they have what's called reabsorptive lesions. And cats unfortunately get this a lot. It's where their body does not tolerate their tooth and reabsorbs it and tries to turn it into bone. What we know from the human side of dentistry is that when people get these lesions, they're very, very painful. And so we like to make sure that we take care of these so that we're not going to have a lot of oral health pain in our cats.
Who monitors my cat while on anesthesia?
Well, our veterinary technicians, our licensed technicians, are the ones doing the monitoring. We also have unlicensed technicians who are going through school and have taken their anesthesia portion of their classes. And we have our doctors that are there during the anesthesia procedure so that we can make sure your pet is as safe as possible. We also hook them up to machines, just like you see in medical shows, that monitor their heart rate, their oxygen levels, their CO2 levels, so that we know that their lungs are exchanging oxygen just like they need to. And we do everything we absolutely can to make sure that your cat is as healthy and safe as possible during anesthesia.
How long does a cat dental appointment take?
So this depends on the cat. It can range in time from under an hour if our health is very, very good and we just have plaque and tartar that we have to get off. We do our full mouth x-rays, we do our full mouth exam, again, just like our dental technologists do for our own appointments. And then we do the scaling to get that plaque and tartar off, get them between the teeth, and then we polish them up at the end. And so that is a very basic healthy mouth dental. If we have diseased teeth that need to be extracted, those extractions take a little bit of time. And depending on the amount of disease and the degree of disease for those teeth, they may take a little bit longer. And so sometimes what we see is we have disease processes such as stomatitis that can happen in a really young cat, even around a year old, that would require them to have all of their teeth extracted for their health so that they don't lose their bone and potentially have a break in their jaw just from existing. So those processes take a lot longer, and sometimes we break them up into two sections just for anesthesia health and safety. We typically don't like to have them under anesthesia more than a few hours, so we may make that into two separate appointments a few months apart.
If my cat needs extractions, will pain medication be given?
Definitely, pain medication will be given. Again, just like our dental procedures, we numb the area. Because they're under anesthesia, the numbing is not as painful. And so we do the numbing to block off a portion of the jaw or the entire section of the jaw so that we can extract those surgically. We're not just pulling teeth. That is old medicine, old veterinary medicine. We do surgical just pulling teeth is old veterinary medicine. That's something they would have done years and years ago in very diseased teeth. We do surgical extractions. So we create a flap in the gum line. We remove whatever portion of bone we need to safely extract that tooth. If it's a tooth that has 2 or 3 roots, we section the tooth so that we're pulling one segment of tooth with one root at a time. This is much safer and helps prevent any breakage of the jaw. And then when the extraction is done, we use that flap that we've created and sew that up so that we have a nice smooth surface of the gum line with some stitches in it. And so again, it is a surgical procedure that we're doing. Was that a complete answer?
Yeah, I think it was. I'm just trying to think. Will my cat be sent home with pain medications?
I'm gonna do that again, but so I'm not like scratching my lip with my
Yes.
teeth.
Will my cat be sent? Will pain medications be sent home for my cat?
Yes, we do. As part of our pre-anesthetic, we do an injection of an anti-inflammatory as long as your pet is not, Yes, we actually, as part of our pre-anesthesia, we do an injection of anti-inflammatory medication as long as it's not contraindicated for your pet. And we also send home oral doses of this medication so that you can either mix it in with food or just squirt it on the gum so they swallow it, so we can continue that anti-inflammatory action for a few days after we get home from our dental procedure.
So here's where you say, if you have questions regarding a typical cat dentistry appointment, please give us a call. We'd be happy to walk you through it. I would say if you have any additional questions.
If you have any additional questions about your cat's dental procedure, please don't hesitate to call us. I would be happy to. If you have any further questions about your cat's dental procedure, please don't hesitate to call us. Any one of us would be happy to answer any questions that you have and walk you through the procedure.